Good afternoon and thank you for joining me. My name is Tracy Moore and today I'm going to be talking about crisis and health communication. Have you ever been frightened by a health scare in the news? If so, you are not afraid. There are many health crises that happen in the United States each year. Some that you may remember would be the Ebola outbreak in 2014 or the H1N1 flu pandemic of 2009. Communication is very important in all aspects of health, but it is essentially important during a time of crisis. The timeliness of that communication can determine how well the public will respond to the information that is being shared. The quality of information is necessary to help people understand what steps they need to take to protect themselves and their loved ones. Today we will be reviewing topics: what is public health? What is a crisis? Risk and crisis communication. Why is risk communication important? Who's responsible for providing that information? And public reactions to the information being shared. What is public health? According to WHO, the World Health Organization, public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. Overall, public health is concerned with protecting the health of the entire population. That population could be as small as a local neighborhood or as large as an entire country or a region of the world. What is a crisis? A crisis can occur as a result of an unpredictable event or as an unforeseeable consequence of some event that had been considered a potential risk. In either case, crises almost always require immediate decisions to be made in order to limit the damage to an organization's reputation. Most crises are out of the organization's control. According to the CDC, Centers for Disease Control and Prevention, effective crisis and risk communication are the following. Be first. Crises are time sensitive. Communicating information quickly is almost always important. For members of the public, it's the first source of information that often becomes the preferred source. Be right. Accuracy establishes credibility. Information can include what is known, what is unknown, and what's being done to fill the gaps. Be credible. Honesty and trustfulness should never be compromised during a crisis. Express empathy. Crises create harm, and the suffering should be acknowledged in words. Addressing what people are feeling and challenges that they are facing builds trust and rapport. Promote action. Giving people meaningful things to do calms anxiety during a time of crisis, helps restore order, and promotes a sense of control. Show respect. Respectful communication is particularly important when people are feeling vulnerable. Respectful communication promotes cooperation and rapport. Why is risk communication important? In public health emergencies, one essential life-saving action is risk communication. People have a right to know how to protect their health and have a responsibility to make informed decisions to protect themselves. Effective risk communication not only saves lives, reduces illnesses, but it enables countries and communities to preserve their social, economic, and political stability in face of emergencies. Who is responsible for providing information during a crisis? A crisis involves many players, and depending on the location and the nature of the event, different agencies and groups take different roles. Government agencies may be involved in the response at some level would include the following: local, state, and federal public health agencies, FEMA, and the United States Department of Homeland Security. Some other types of organizations that may be involved at some point in time would include police and fire departments, emergency medical services, healthcare organizations, non-governmental response organizations such as the American Red Cross, faith-based organizations, and businesses. It's important to remember that at the center of any crisis are those individuals, groups, and communities most directly affected. All disasters are local. The community is the first and most important responder. Public reactions to crisis. The most important response to a crisis is communication. Each crisis is different, and how they are communicated must be different as well. When confronted with a crisis, people will react differently. Some will feel panic and hopelessness, but the majority of people can act rationally and engage in supportive and selfless behaviors to help friends, family, and neighbors. In general, the public wants access to as much information as possible, but the reliability of that information must also be on point. Otherwise, there will be a loss of trust. In conclusion, as we've stated today, communication is extremely important in a time of a public health crisis. The timeliness of that communication is just as important as the quality of the information being provided. I encourage each of you to take the steps necessary to build your communication skills to help in the next public health crisis. Thank you.